A new study finding the use of weight loss drugs in kids has skyrocketed. Take a look at this. The study found that prescribing GLP-1s for weight management in kids aged 8 to 17 increased 65% after the American Academy of Pediatrics issued guidelines recommending them 2.5 years ago.
My teenager's on a GLP-1, and today I got a phone call from the school nurse telling me that I had to pick my daughter up because she wasn't feeling well. I go pick her up from school, and she gets in the car, and I was like, what's going on? Tell me what you're feeling. And she goes, I got a little bit of a headache. I'm a little lightheaded, and my stomach kind of hurts. And I said, okay, did you eat lunch? Because it's about noontime now. She says, no. I said, did you eat breakfast this morning? No. Well, when was the last time you ate? Yesterday, late morning. That's what she tells me, yesterday, late morning. Now, I sent this kid to school with lunch yesterday, with snacks because she had lacrosse. When she got home, I made her dinner. I sent her to school with breakfast and lunch today. Why has it been since yesterday morning? I just wasn't hungry. I talk to people on a GLP-1 all day long, and my number one thing I say to people is you need to eat little bits every couple hours. You need to make sure you're fueling your body with food so we can avoid things like this. What I have found is that the longer I have been on, and she has been on, we forget sometimes about the fundamental foundation of what makes ourselves feel better. I can tell people all day, but when it's me, I struggle to remember. And apparently my daughter does too. So I get her home, she eats a little bit, she drinks some water, she rests, feels much better. Just goes to show that no matter how old you are or how long you've been on, we still need to stick to the fundamental things.
Today we're talking about GLP-1 medications, weight loss drugs, kids, teenagers, obesity, appetite suppression, side effects, rapid weight loss, food noise, and the bigger question of what happens when a medication that reshaped adult weight loss starts becoming part of childhood medicine. This isn't a video shaming parents or kids, and it's not just a beauty trend either. This is medicine. And when medicine turns into a trend, people start focusing on the results and skipping the responsibility. That's what worries me.
Sitting in the parking lot of the ER right now, my 14-year-old has been vomiting since 3 a.m. and they're trying to figure out what's wrong with him. And I can tell you that some people in the medical community are not very friendly to kids who are in a bigger body. Somehow they feel like they need to tell them what they should and shouldn't be doing. And it's just triggering to me to hear and try to explain to me why they need to do a CT scan and not an ultrasound, talking about how his belly fat is contributing to what's going on, which it probably is. So still trying to figure out what's going on with him. And I'm just trying to be very patient and try to answer all the questions. And I just feel for my son because the moment that they asked him his weight, he just paused. And he just was so frightened to tell them that he weighed 360 pounds. Yes. He is 14 years old and he weighs 360 pounds. And that's why I'm going to continue to advocate for GLP-1 medication for teenagers, specifically Wegovy. I've been waiting and waiting and waiting. The shortage is causing us not to continue on his weight loss journey. And I'm just desperate. I don't know what to do. I really don't want to go the compound route, but just trying to figure out how I'm going to make him feel better during this visit. And they run all of these tests.
I know the internet loves to sensationalize things, and sometimes I just grow weary of it, and I just wanted to give a different perspective. I know somebody who was on a TV show. That TV show reached out to her again, and she was like, hey, here's my friend. You want to talk to them? So this person went on the TV show, and the whole storyline was her kid did GLP-1 for a little bit. I mean, that's it. Well, her kid did GLP-1 medication because I shared with her how my child is on a GLP-1 medication. And my child has been on a GLP-1 medication for over a year now. Now, I know that's like a sound bit and people want to over sensationalize it, but I want to tell you something that should be sensationalized. Let me go back a little bit further. My youngest child was approved to be in a tirzepatide case study. This was 2 summers ago, actually. He is single digits. So they're actively doing studies on that. He was approved. We were so freaking excited. Yes, there was anxiety involved in it, but we were so freaking excited because anything we can do to kick obesity's ass ahead. Statistically speaking, the sooner you can address obesity, the likelihood of it not being a problem or as great of a problem in your adult years, okay? So we got approved. It was in Oklahoma. We were so excited. We were going to do this thing. I was going to fly out with him and do all the things. When it got down to it, we realized that he and I were going to have to fly to Oklahoma every week, once a week, for almost 2 years. And we would have to stay for 5 days, like every couple weeks. It was going to be impossible for us. And I really mourned. I mourned because adolescent obesity is horrific. It's bone crushing. Take it from me. So when I took my older child to a obesity specialist, we were just doing what the doctor told us to do. We went to I live in Cincinnati. We went to Cincinnati Children's. They had us meet with a doctor. They had us meet with a nutritionalist. They had us meet with an exercise list, whatever it is. At the end of that meeting, I brought up GLP-1 medication, and knowing that it is FDA, one of them is FDA approved at 12 and up. When I tell you the way that this obesity specialist, pediatric doctor looked at me, I was like, holy freaking crap. I think CPS is going to show up to my house tonight. She was appalled. She was appalled by me bringing it up, even though it is FDA approved. But you know what that woman said to me? She can have bariatric surgery when she's 13. I want you to hear that one more time. Giving a child a shot, a weekly injection, is more taboo than chopping their stomach out of their body. If you do not know me, I had bariatric surgery as a teenager. BPDDS. It is the Mac Daddy of all Mac Daddy surgeries. Guess where that has landed me? Weak bones, weaker eyesight, losing teeth, chronic fatigue, can't get my labs normal. And the older I get, the worse it becomes. Giving your child bariatric surgery as a young teenager is less taboo than a GLP-1 medication. Please help me understand that.
You know, we know that the obesity rates, particularly in kids, have doubled since COVID. We're talking about 1 in 5 kids that are at risk, not only for obesity, but obesity-related complications. So parents are struggling, kids are struggling, and doctors are struggling. We want to help these patients, but we currently do not have any FDA-approved medications for treatment of obesity less than 12 years old, which brings us to the situation when you have a kid with severe obesity and liver dysfunction, sleep apnea. These are kids you want to help. So some doctors, and I poll my colleagues, this is not a common circumstance, but it is something that doctors are offering in rare circumstances, are offering a GLP to help, because we know those risks are so significant for kids.
As a pediatric weight management specialist, I get asked questions about the new medications that are out there, GLP-1 agonists. And these have been out for some time used in the adult population for diabetes. Recently, they have been approved to use in children. And this is actually wonderful news. January of 2023, the American Academy of Pediatrics put out new guidelines, and they suggested that we offer treatment at the highest level necessary for children when they are diagnosed with the disease of obesity. GLP-1s are actually a hormone that our body produces naturally. It's in the small intestines. And how it works is it helps you feel full longer. What's really exciting about having GLP-1 agonists out there, we now have a tool in our toolbox, something that we can use to help families, because we do know that obesity is a disease, and it's important for us to have something that we can use.
Adults can usually describe what they're feeling: nauseous, constipated, dizzy, not eating enough, heart racing, something feels wrong. Kids don't always have that vocabulary. A teenager might just say they feel weird. They might skip meals because they're not hungry, get lightheaded at school and not connected to food, or play a sport without realizing their body still needs fuel even when their appetite is gone. That's the difference. A child's hunger cues can be quieted, but their body still needs the protein, calories, hydration, and vitamins to grow, think, learn, play, recover, and function. If a medication is making a child forget to eat, the adults around them need to be more aware, not less. The goal can't just be weight loss, it has to be health. And health isn't just a number on a scale going down.
1 in 10 Americans have tried a GLP-1 medication. I'm concerned we're going to see a wave of people who've been on these drugs who end up in a worse place than where they started.
update. I do have gastroparesis. My test results came back in. So yeah, while I was on a GLP-1, aka tirzepatide, that's what I was on. I did lose 50 pounds, so I lost a lot of weight. But now I have, is that a chronic illness? I have to look, honestly I have to do a lot of research into it, because now that's something that I deal with, and I take Compazine, which is a very strong nausea medication, because Zofran was not working for me. I was like extremely nauseous all day long. The night that I went to the emergency room, well, it was more like the morning, because all night, anyways, I was just really sick. Zofran was not working for me. I eat very little bit. I can only eat so much at a time anyway, but I get an extreme stomach ache when I'm on my menstrual cycle. It's even worse than I am right now. And so it's even really worse. I had to get, thankfully, my medication for nausea refilled. But yeah, I just found out that I have that, so I have to look into it.
This morning, I was this fucking close to going to the ER. I had the most intense, insane, horrific, like, stabbing pains in my stomach. It was like, you know, and I was just like, oh my God, on my way to work. And then when I got to work, it didn't get any better. And then when I got home, it didn't get any better. And I was like, what the fuck? So a little backstory. Yesterday, I had a teriyaki bowl or whatever, the chicken and rice one from Costco. I love those. But I feel like the last couple times that I've had one, it's kind of made my stomach a little upset. And so I was like, oh, well, maybe, you know, like, I don't know. Maybe this time won't hurt my stomach. Why did we do that? Anyways, I had one for lunch. Got home. I think I had like 2 of those little tiny personal size pizza slices because I was still kind of hungry. And then for dinner, I had a small bowl of spaghetti. And I was like, that's not that much. And I know that wasn't like the best things to eat all day. I understand that. But anyways, 12:30, you know, at night hits and I'm in the bathroom throwing up. I get up for work. I'm feeling a little better, like a little better. So I'm like, okay, I can make it. On my way to work, about halfway there, I'm like, ugh, stabbing. Get to work, stabbing, and I had to go to the bathroom really bad. So I was like, well, maybe I'm just really constipated, you know, because a GLP-1 will do that. Went to the bathroom, went back in my office. I was sitting down. I was like, I cannot sit here and be productive. Like, I'm going to cry, or I don't know. And I don't like crying at work. So I messaged my boss. I'm out of here. Sorry. Might go to the ER. But that shit's expensive. So I was like, I can hold out. So anyways, I get home. I'm in the bathroom for Lord knows how fucking long, trying to excrete everything from my body because I'm like, I don't know what's happening with my stomach, but whatever's in there right now is not happy, okay? And it's kicking my ass. So I get done after, I don't know how fucking long, I go and I just lay in bed and I'm reading my Kindle to take my mind off of it, you know, because you got to do something else. It was either TikTok or Kindle, and I chose Kindle. And I just started feeling better. At this point, it's like 11, I think. I think I got out of there. Yeah, I got out of bed at like 10:40 to come get some water, and I was like, this is getting better. I'm glad I didn't go to the ER. But holy fuck, made me question everything. This was the first day that I've been like, should I be on this medicine? And I'm like, okay, if it was the medicine, yeah, I feel like I need to get off this shit. If it's the consequences of me eating rice and chicken, maybe that's on me. I don't fucking know. But you girls, I got 187 today. Thanks for being sick. So I've lost 73 pounds, and I'm like, okay, I'm almost there. I could probably do the rest on my own if I really tried very, very, very hard, but I don't know. So now in my head, and this might be stupid, and you can tell me it's stupid, I will understand. I'm like, maybe I should give myself a couple days and try another one of those bowls and see if that was it, or see if it was a one-off. You know, I need to experiment, because I want to know what the fuck happened. I need to know. Because if it's the medicine, yeah, I like this shit. I can't do this for much longer if that's how this is going to end up being. And I've heard of people getting that like gastroparesis. Very rare cases. Yes, it doesn't happen very often or whatever. But I'm like, with my fucking luck.
A suppressed appetite can feel like success at first, especially for someone who's struggled with food noise, cravings, or constant hunger. Suddenly, they're not thinking about food all day. They're eating less. The scale moves. People notice. It feels like the thing that finally worked. But there's a dark side when people stop eating enough. The body still needs fuel, and eating too little day after day can lead to weakness, dizziness, headaches, nausea, constipation, low blood sugar symptoms, muscle loss, hair loss, just running on fumes. With kids, that matters even more because they're not just losing weight, they're still becoming who they are. Bones, brain, hormones, and their relationship with food are all still developing. So the question isn't just, did the medication work? It's, is this child being supported while it works? Because without close attention, weight loss can look like health while the body is quietly being underfed.
GLP-1 is the best thing popping until it puts you in the hospital. About 2.5 weeks ago, I called rescue. I could not breathe. My heart was like literally about to beat out of my chest. My heart was beating so fast. I could not breathe. I could not speak. I thought I was about to die. I went to the hospital. They did blood tests and everything. Oh, you're fine. Sent me home. Went right back the next day. Same thing. Oh, you're fine. Sent me home. You're fine. I literally went to 3 emergency room visits and 2 hospitalizations, y'all. I was so sick, nauseated. It felt like my head was spinning. I could not breathe. I couldn't catch a breath. I was having epigastric pain, constantly nauseated. My sugar just kept dropping. I felt like I was going to pass out. It was the worst experience of my life. The GLP-1 got the weight off. I lost about 70 pounds, y'all, but I will never, ever, ever, ever do another GLP-1. I will just have to get the weight off the natural way. I'm going to continue to eat right. I'm going to continue to exercise. But this last time I was in the hospital for 7 days, y'all. One night I sat there in that hospital bed and I kept telling him, like, I can't breathe. I can't breathe. I feel like I'm going to pass out. The nurse comes in. She checks my blood pressure. It's 250 over 150. All I see is nurses and doctors everywhere, all in my room surrounding me. I felt like I was about to stroke out, y'all. They came in, they did a stat EKG, and then they turned around and did a CT of my, I think they said it was like a CT of my chest. But when I tell y'all, I thought I was losing the battle. Me and God had talks every night while I was in the hospital. I thought I was not going to make it out of there, y'all. My sugar kept dropping. It kept dropping no matter what I would eat. It would kept dropping. So they had to end up putting like the sugar IV through my IV to keep my sugar up because it just kept going down. I was so terrified, y'all. I have never, in my 37 years of living, I have never, ever been through anything this traumatic in my entire life. I know my hospital bill is probably about $5 million, but they can go ahead and put it on my tab because there's no way I'll be able to pay them back. But for all the nurses and doctors that helped me through this, I appreciate you guys. I couldn't have done it without you. But for all my ones who are still on the GLP-1, make sure you're eating your protein, make sure you're eating your veggies, your fruits, make sure you're getting everything in there. Because you don't want to end up like me. I thought I was eating enough because the GLP-1 curbs your appetite. You eat and it feels like you're constantly full, so you really don't want to eat. But you cannot do that on a GLP-1. I had to learn the hard way. But the panic attacks are starting to get better, thank God. Those panic attacks, I don't wish that on my worst enemy. They are getting much, much better.
Hi, my name is Destiny Fountain. Today's date is September 9th of 2024. And I am making this video for awareness. I have had the worst week and a half of my life. Not quite 2 weeks. This Thursday will be 2 weeks and it's Monday. I'm here to talk about the weight loss drug called semaglutide. I'm currently on 2.5 milligrams a month, 48 units. I take just a little bit less than that. I usually take about 45, 46 units. I'm here to talk about my experience. I started it in January. I was on, tapering up for 3 months, and then I've been on this highest dose for 6 months, and I'm having to stop it cold turkey because of the issues that it has given me. I didn't have any pre-existing heart issues. I'm going to go ahead and preface that. I had a little bit of high blood pressure, just a little bit, because I was a heavy person, and that was it. I've developed what I guess is POTS. Unfortunately, I don't have insurance because I lost my job. I just started my dream job, and I lost it because of my illness. And not only have I developed POTS, but I'm having to wear a heart monitor because my blood pressure drops into, 90 over 60 range, which I've never seen those numbers before. I have chest pains, my watch picking up irregular heartbeats. I've been to the ER 3 times, urgent care a couple times. My PCP, cardiologist turned me away because I don't have insurance. No answers. They did CT scan with dye and said there was nothing there. Blood work was fine. Right? But I'm permanently stuck like this right now. I haven't had any relief in almost 2 weeks. It started with, on a Thursday night, I had just all of a sudden, I thought I had a mini stroke, but they said I'm fine. I thought I had a stroke because all of a sudden, all the lights went out. I had a good day. I was eating dinner and all of a sudden all the lights went out in my body for a split second. My heart beat like it was really hard. And then I had a wave of anxiety. And I could physically feel the anxiety come from my chest through my whole body. Couldn't shake that anxiety for days. It was debilitating. The only thing that would keep the anxiety away is if I ate something every 2 hours. And because it started messing with my sugar. And I don't wish this on anybody, but I'm just here to talk about that. This drug, there's no one to help you if if you have these side effects, they're trying to say, oh, it's not from that. It's not from that. I've never had problems before, and it started on my last dosage day. And if they can say it all they want, but I developed a fast heart rate, but they want to tell you that that's going to be just fine and that's normal and that's part of the symptoms when it's definitely not healthy. And I want you to also know, if you do any research into this drug, that not only are the symptoms that this drug helps with, they're also the symptoms that you can develop.
For some people, that's genuinely all it is. Manageable, nothing dramatic. For others, it's more serious. The video includes stories of severe stomach pain, vomiting, ER visits, possible gastroparesis, blood sugar drops, panic symptoms, and people questioning whether the weight loss was worth feeling physically wrecked. That's the part people tend to brush past, because when something becomes a trend, the focus goes to the success stories, the before and afters, the pounds lost, the compliments. But side effects are part of the story too. Not because everyone will have them, but because some people will, and if you're one of them, it's rare, it doesn't help. That's why informed consent matters. People need to know what to watch for, when to call a doctor, and that severe pain, constant vomiting, extreme weakness, fainting, chest symptoms, vision changes, or mental health changes aren't things to push through just because the scale is moving. A lot of the GLP-1 conversation gets softened. You might feel a little nausea, you might get constipated, you might not be hungry.
The GLP-1 potentially ruined my life and gave me gastroparesis. Story time as it's actually happening, part 2. So as you can see, I am not well, and I just made a video on part 1. I'm sorry that it was long, but I need this to get out because I did not know that this was a thing. Of course, the provider told me about it very briefly and made me sign a paper saying that I understood, but she did not tell me or warn me that this is a serious possibility, like this is a big possibility of it happening. She said it was so extremely rare, and she also knew that I had IBS going into this. So part 2. So I left off in November, starting off with a 3-week long episode, what I'm calling episodes, extreme immediate gastric dumping from the rear end, and severe stomach cramps, pain, feeling like I am going to pass out, blacking out, low-grade fevers, not being able to eat or drink anything without it coming out immediately, to the point where I literally thought I had like H. pylori, or I had some type of bacterial infection in my intestines or something. So I am on my doctor's ass, like my primaries, and I'm like, something is wrong. I need help. I need to get into a GI doctor. I need to get a colonoscopy scheduled. Like I need to get these tests done. Nobody's listening to me. Then in the midst of the worst part of that episode, I go to the hospital. This is the first time I went to the hospital, on November 13th. I went to Sacred Heart Hospital. They leave me out in the waiting room the entire time. They take me back to get an IV in me, give me some fluids. They gave me nausea medicine, and they did a CT scan, and nothing was found. And they sent me home with dicyclamine medication, which is they give to IBS patients. The doctor literally laughed in my face. She smirked in my face when I said that I thought I had SIBO, or I had this, or I had that, and that I needed to desperately be tested for that because I feel like I'm on my deathbed, and that I can't keep anything in, and I'm worried about the permanent damage I'm causing, and I'm worried that I'm not getting enough nutrients for my body. She smirked at me. So, with that being said, I go home. I'm in agony. I'm barely eating anything. And then I start to finally be on the mend by the time I actually get in with the GI doctor. I tell her everything that's going on. I'm crying. I'm begging her for help. She finally gives in, orders me a colonoscopy, which I can't get into until the end of February. Fine. I knew that those were going to be a ways out. That's fine. And then she gives me a stool sample at-home test that I need to drive back up to the lab once completed, which I have not been able to do because I wanted to do it during an episode, number 1, which is reasonable. And number 2, I didn't realize, because during this episode, I went to go do it. And it says on the paper that I cannot take any of the stomach meds that I've been taking for 48 hours, which I'm living on the stomach meds right now. And so I'm like, I just screwed myself because I wish I would have read that paper before waiting this long. Anyway, she also gives me a SIBO test. I haven't done that yet because I wanted to wait until I had another episode. Now,
with this episode. I am so ill. This is the worst one by far. I feel like I'm on my deathbed. I could not imagine drinking a glucose packet right now. Right now, I've been sipping on this regular sugar Gatorade and water. And I have been drinking chicken broth and nibbling on crackers for 4 days now. I went to the hospital this last Wednesday. I ended up voluntarily leaving without medical care because they left me in the waiting room as I was literally nodding out, passing out. My blood sugar was so low, and no, I'm not diabetic. So I left. And then Wednesday, I was severely bloated and cramping and extremely weak. Tuesday I went to the hospital. Wednesday, I was recovering at home. And very, very weak, could barely get out of bed. Thursday morning, I wake up at 5 o'clock in the morning in agony. The worst stomachache I've ever had. I can't even call it a stomachache. It was so much more than that. It hurt so bad that actually having a bowel movement hurt my rear end so bad that I was screaming at the top of my lungs because it hurt so bad. I felt like my organs were going to come through my rear end into the toilet, and it felt like I was dumping lava, and just the smallest amount would hurt so bad I could barely wipe myself. So I call my primary, I tell the nurse what's going on, and I said, I'm tired of me going to the hospital and them not helping me. I'm so desperate. I feel like I'm dying. Please help me. So she advises me to call an ambulance again, so this will be the second time this week to call an ambulance to go to the hospital. So I call the ambulance, and my husband cannot get off work because he had nobody to take over. And what he does for work, he provides heat in people's homes. And if he were to leave and cancel those appointments, then these people would not have heat in their homes, and it's very cold outside, so I could not have that on me on top of everything. So I call my sister-in-law, who is very pregnant, and I say, hey, are you busy? Is there any way you can meet me at the hospital? I need somebody there that can advocate for me, because my brain was not, I could barely form a sentence. I call an ambulance. I get taken to the hospital. Of course, they wheel me out into the lobby because they have no beds because it's peak flu season. And I was there for 11 hours, and because they were hoping that I was going to be able to give them a stool sample, but I did a complete gastric emptying, and because I have not been eating much for the last few days, that I had nothing left to give. I even sat on the toilet and tried so hard for 45 minutes, pushing as hard as I could to give them a stool sample because I was so desperate to do that because I knew that test needed to be done. Couldn't do it. Not even a single drop came out. And mind you, I've had nothing but water, liquid diarrhea for days. Anyway. Well, anytime I eat anything anyway. And undigested food. So, when I try to tell the doctors that I don't vomit, they don't take me seriously. They take me as I'm being overdramatic and that my symptoms aren't as bad as they were, because if they were as bad as I'm saying they are, then I would be vomiting uncontrollably. When I tell you that I don't vomit, it is not something that I'm proud of. It is something. I don't know if you just heard that. That is my stomach. Anyway, I do everything in my power not to vomit because I projectile vomit so hard that I choke on my own vomit and I black out. And that's just a fact. Anyway, I am so grateful for the doctor that I got because at first I thought she was not going to take me seriously, but thankfully my sister-in-law was there, so she was filling in the gaps that I was leaving out, which there was a couple of things that I forgot to tell her, like the part that I blacked out on the toilet. And she ordered me a CT scan with contrast. She ordered me an ultrasound of my gallbladder, my liver, and my right kidney. I have ketones in my urine because I am literally starving myself. If you don't know what ketosis is, go look it up. I've lost 5 pounds in 3 days. It is so unhealthy. I am currently laying with my pillow on my stomach in the same clothes that I've been in for days with my blanket and a cool cloth because I feel like I have a fever, but I don't have a thermometer. My husband's at the store right now getting me a thermometer.
Here's what really concerns me. When someone has wanted to lose weight for a long time, it's hard to stop something that's working, even if they feel sick, are barely eating, Or know something feels off because the scale keeps going down. And that can be its own kind of addictive. Not because the person is shallow, but because we live in a world that rewards weight loss so aggressively that people start tolerating things they'd never otherwise put up with. A smaller body gets praised even when the person inside it feels terrible. That's when we hear things like, I lost 50 pounds, but my stomach isn't working right, or I lost weight, but I was hospitalized. At some point, we have to be able to ask whether the result is still worth the cost without that being treated as anti-medication. It's not anti-GLP-1 to say side effects matter. It's not anti-weight loss to say nutrition matters. It's not anti-health to say kids need close monitoring. That's just common sense.
Last week, y'all, I started having major stomach cramps. And I'm talking like, this is the worst pain that I have ever felt other than contractions. And it was very close to contractions, but it was more up here at the top of my stomach. And for 2 days, I was in the ER, and I used to be an emergency room nurse. So it takes a lot for me to go to the ER, okay? I have to be near death. But I started having severe stomach pain and diarrhea. I could hear my bowel sounds, just like bubble guts. I started vomiting. And the nurse in me, I really thought maybe I had like a bowel obstruction. I wasn't sure. So last Monday night, I went to the ER. They did a CAT scan, said everything looked okay, prescribed me Zofran, maybe just a little sludge in the gallbladder. Okay, so Tuesday, I get up and I didn't eat a lot that night. I had some toast when I got home because I felt really hungry. That morning, Tuesday morning, I didn't eat anything. Took a nap. I was exhausted. Then stomach cramps, intense stomach cramps, set in about 11 o'clock. They were so bad that I was home by myself. I had to call the ambulance to take me back to the hospital because literally I thought I was dying. Long story short, which we're already kind of at long here, but I have mild stomach paralysis and gastroenteritis, and colitis, which basically the stomach paralysis is where it's very common with GLP-1s. A lot of people that have issues, stomach paralysis can be it. And basically it's because things are not communicating and food is your stomach is not pushing the food through to be digested. That's kind of like the short-term version of what's going on. And this is causing my GI tract to cramp. Now the cramps have been gone, thank God, for about a week now, but it took me getting a scope. It took me doing a swallow test. I've been on a medication since last week to help with stomach cramps. Phenergan, Zofran, all the things. But I say all of this to say, make sure, because mine was prescribed not by a doctor that I go in and see like monthly or weekly. It was from one of the companies where they ask you very vague questions and like, have you taken it before? Do you have any issues with your thyroid? Do you have any, they just very vaguely go through your history, prescribe you the medicine, start you out on a dose, and then pretty much it's just like, here you go. And I'm not bashing anyone. I'm not saying that that's not okay. But me as a nurse, I thought I would be fine. And then I wound up very sick. So know your dose, know the medication, have a doctor follow you, have your labs checked, know that you're on the right dose, because I thought I was okay. I thought I was on the right dose. And turns out my dose was extremely too high. Or I won't say extremely, but it was too high. And so now I have been on a liquid diet bumped up to a soft diet, all the things. And, you know, I don't know if I'll go back on it. I was on tirzepatide, and it really did curb my appetite. But at the end of the day, if I do go back on it, it will be a much smaller dose to start. And I will probably remain on that dose for a long time. And now that I am in with a GI doctor, he has told me, like, listen, you will be able to go back on the medication, but you need to stay off of it at least for the next month.
Hi, Dr. Tanya here. I got lots of media calls this last week on the rise of GLP-1 use in kids, so I want to summarize some of my news segments for you. So use is really determined in a case-by-case basis. It's officially approved by the FDA for obesity in kids 12 and up, but many pediatricians, including myself, pediatric endocrinologists, and GI specialists are using them off-label for younger kids. We do have to be really careful, though, and aware that these are still growing and developing children. So they need to get a certain amount of nutrition and specific nutrients in their body every day to help them grow and develop properly. So it's usually a team approach with a dietitian, a psychologist, and a fitness program as well. Now, what surprised me most when I started prescribing these medications for my families is that my patients that were thinking about food 24/7, even sneaking food, the semaglutide really quieted that noise, so they were able to learn to eat healthy portions of appropriate nutrient-dense food and then focus more on their school and learning and exercise and friendships. Now, side effects in kids are less common than adults, probably because we're using the lowest dose needed, but they can have GI symptoms such as constipation, headaches and fatigue, and rarely pancreatitis. But in general, in the long run, these kids will actually end up being healthier because they won't suffer the secondary consequences to being overweight, such as developing type 2 diabetes, hypertension, heart issues, early puberty. They also seem to be mentally healthier because they aren't constantly thinking about food and they're able to focus their brain and energy on all of the other daily functions of living. But these and all medications and weight loss programs for kids really do need close monitoring, so make sure you talk to your pediatrician or specialist and closely work with a team if you are considering these medications for your kids.
Some parents are desperate for help. It's easy for people online to judge, but if you're watching your child struggle with severe obesity, bullying, pain, or early signs of serious disease, desperation makes sense. If a doctor says this medication could help, of course you'd listen. That doesn't make you a bad parent. It makes you a parent trying to use the tools available. The video includes a mother talking about how painful adolescent obesity can be and how frustrating it was that GLP-1 medication felt more taboo than bariatric surgery for a teenager. That's a fair point. If the alternative is major surgery, of course some families would rather try medication first. So again, this isn't black and white. There are kids who may benefit, families who need options, and doctors trying to prevent serious long-term problems. But because kids are involved, the standard has to be higher, the support stronger, and the conversation has to include both the benefits and the risks, not just one side.
Something that's really not talked about enough when referencing GLP-1s is this negative stigma that they're so bad for your health. I feel like more often than not, people who don't really understand GLP-1s will ask me, aren't you afraid of the long-term effects? No, I'm not. I'm not any more afraid of the long-term effects of GLP-1 than I was about the long-term effects of off-the-charts inflammation markers, of unmanaged autoimmune disease, of being overweight and all of the issues that come with that. It's a genuine question for people who don't understand GLP-1s. Do you get headaches? Do you get joint pain? You get backaches from your job? Are you concerned about the long-term effects of ibuprofen? Are you concerned about the long-term effects of Tylenol? Even those over-the-counter meds that people use all the time for every little ailment contain a lot of long-term effects. We can only do our best. We can only do, our own research and look at the research that's been done by others and decide what is the best fit for us personally. That's the beauty in being our own people, right? We can make decisions for ourselves. My decision doesn't impact you. My decision doesn't impact me. Am I afraid of long-term effects? I think there are long-term effects to every single decision we make in life, whether they're good or bad. I spent nearly a lifetime seeing abnormal inflammation markers in my lab work that for once are completely under control and normal. And if that doesn't speak volumes for the fact that my GLP-1 is helping me more than it's hurting me.
So this seems obvious to say, but Big Pharma is using the same tactics to sell GLP-1s as they did 30 years ago to sell OxyContin, which then resulted in the opioid crisis.
GLPs are the biggest thing that I will ever see in my lifetime in medicine. They will change medicine forever in a way that is completely unrelated to weight loss. Their potential for shifting so much in our physiology goes so far beyond weight. But I think the way that they are being used currently can be incredibly harmful. And it is way over medicating people. Like, we don't have any business practice taking the doses of medication that everyone is being given. Not only are they starting on too much, they're incrementally being inappropriately increased unnecessarily. And so what's happening at large is people are not eating food. They have been anxious to lose weight. They finally have this thing and they're like, yes, I'll increase my dose. Meanwhile, they're eating 200, 500, 600 calories a day. They're rapidly losing weight. They're losing muscle. They're losing collagen. They're losing hair. They're getting pancreatitis. Their blood pressure's dropping so quickly. They're having vision issues. Meanwhile, rarely are they being educated. Rarely are they being closely followed.
People often defend GLP-1s by pointing out that untreated obesity has long-term effects to inflammation, diabetes risk, heart issues, joint pain, sleep apnea, high blood pressure. They're right, and it's not balanced to only interrogate the medication's risks while ignoring the risks of doing nothing. But it's also fair to ask what happens as more people start these medications younger and younger. What does long-term use look like? What happens to muscle mass, bone health, puberty, mental health, a child's relationship with hunger? What happens if insurance stops covering it or side effects show up months in? None of these questions mean the medication is bad. They mean the decision is serious, and serious decisions deserve serious conversations. So here's where I personally land on this. I'm not against GLP-1 cess. I think there are real consequences that come with them, but I'm not sitting here saying the medication itself is the villain. I think the bigger issue in America is our habits. And I want to be careful here, because when people say, I've tried everything, I believe them. I'm not calling anyone a liar. But a lot of us are eating mostly processed food. We're not moving our bodies the way we used to. And if you're consistently taking in more than you're burning, weight loss is going to be an uphill battle no matter how much willpower you have. We're living in a moment where most of our lifestyles are built around sitting at work, in the car, on the couch, and food quality just isn't where it needs to be. That's not a personal failing. That's the environment we're all navigating. So when it comes to putting a child on a GLP-1, I don't think that's the answer. Kids are still growing. And like some of the doctors in this video pointed out, we don't fully know what these medications could do to that growth. That alone gives me pause. What I'd rather see is more focus on food quality, getting real nutrients from real food instead of empty calories, because that pattern is a big part of how we ended up here as a country. Again, I'm not judging anyone. This isn't about shame, but the risks are real and people are ending up hospitalized. So before you go on a GLP-1 or before you consider putting your child on one, just know going in that there are consequences that could come with it. So after all of this, I don't think the real question is whether GLP-1s are good or bad. That's too simple. The real question is how we're using them, who's being monitored, who's being educated, who's being dosed carefully, and who's just being handed medication without enough support. And what happens when a drug meant to treat a medical condition gets tangled up in beauty culture, social media pressure, and now childhood health. GLP-1s may help some people. They may change lives, reduce food noise, help people lose weight when nothing else worked, improve health markers, give families a tool when they feel out of options. They can also come with real side effects, stomach problems, vomiting, weakness, muscle loss, mood changes, serious GI issues, ER visits, and for some people, that experience can be traumatic. So I think we hold both truths at once. These medications can be helpful and harmful when used without enough care, life-changing and overused, medically necessary and at times pulled into beauty culture. They can help kids with real health issues, and they can also create new problems if kids aren't eating enough, aren't being monitored, or come away learning that their body is something to shrink. That's the uncomfortable middle, and that's where the real conversation lives, because children need more protection, more education, more support, more nutrition monitoring, more emotional care, and more adults willing to say the goal isn't just weight loss, it's a healthy child.